Thank
story.
you. Gosh, we think you're amazing. And the epigastric pain that I had that you helped me solve, and just that alone, you are always will be my favorite.
That's right. You're one of the people who did great with the hiatal hernia reduction,
Oh my
um,
God.
which
Yeah.
is which is one of my favorite things. It doesn't always work, but when it works, people think I'm a wizard.
Oh, for sure.
Um,
You are totally in my book. You are.
okay, so what just happened here? Why is my lovely patient so happy with me? And the answer is that we fixed her hiatal hernia. I treat a lot of patients with chronic GI symptoms that will come in and they may have fullness after meals, bloating, heartburn that doesn't go away. And a hiatal hernia is one of the reasons why that can happen. So to answer how I fixed it, you have to understand what a hiatal hernia really is. So a hernia is when an organ in the body moves from its preferred location to somewhere it shouldn't be. It moves through tissue and finds a new home where it really should not be. And this can cause symptoms, right? So in this case, a hiatal hernia is when the stomach moves out of position. And normally the stomach is supposed to be safely seated just under the muscle of the diaphragm, right? That helps us breathe. But sometimes for anatomic reasons, sometimes when people gain weight, and sometimes when they have connective tissue problems, the portion of the diaphragm that opens so that the esophagus can move through the diaphragm and empty into the stomach, that little portion becomes bigger and weaker. And that allows the stomach to migrate upwards through the diaphragm. And so we call this a sliding hiatal hernia because it can move up and down. And this is one of the reasons why GI doctors may not see it when they do an endoscopy or if they do other imaging like a CT scan. The other issue with imaging is that doctors just aren't taught this is a problem. It absolutely can be a problem that generates symptoms for people. And it's why I take it seriously. So, 10% of the patients in my office, when they have these symptoms and I lay them down on the exam table, right? When I feel, and this is the area, just my ribs here, inferior margin of my ribs are here. When I press in gently to my patients, I can feel a little bump, and that's the tip of the stomach. It actually feels like the tip of the nose, right? And when you very gently encourage it to move downwards with manipulation, sometimes you can feel a big gurgle and the patient will go, I can take a deep breath, right? Because that stomach, where it's in the thoracic cavity, pressing on heart, lungs, all of the mediastinal tissues, when it relaxes back into its place, the body feels much better. You'll sometimes see constipation, heart palpitations go away with this procedure, and it's really safe and fun to do. So if you've been struggling with epigastric pain, please ask your doctor if it could be a hiatal hernia. And if so, there are plenty of resources online for how to reduce it or find a good doctor.